Welcome back to the program. So happy to have you here on Health Call Live. Our guest this half hour is Nathan Miller. He is a doctorate in physical therapy with Steppin Up Physical Therapy. 7 years of training you've had?
Yeah, thanks for having me.
Yeah, I'm glad to have you on board here. We're going to be talking about neck pain, back pain, and jaw pain, and they're all connected potentially.
Absolutely. Lots of times it starts with the neck, and then depending on what's going on, people may just have neck pain. They may have pain that radiates down an arm. Could be numbness, tingling as well. Sometimes it manifests itself in the upper back, or like you said, even jaw pain can be related to neck issues, jaw issues. All of that can be treated by physical therapists with the right situation.
So by the time somebody comes to see you, they've suffered for a while, I assume, right? Or is it sudden onset?
Either way, there's lots of times chronic issues that lead to it. Lots of times that is a postural type of thing. But other people come to us with neck pain because they got in a car accident yesterday, and they come to us right away. If that's the case, then we need to do some certain testing to make sure that they are appropriate for physical therapy. If they've had x-rays, those kind of things help out a lot. If they haven't, then I'm going to be very careful before I jump right into it, and I may have to refer them to a physician first, and then they can come back and start physical therapy.
So the neck is an incredibly complex collection of muscles and bone. Walk me through some factoids around my neck.
Sure. So different things that people hear when they hear they have neck injuries. Lots of times, there may be a herniated disc, or they might be a facet joint thing. So what is all that? There's 7 cervical vertebrae, so the bones in the neck, there's 7 of them stacked on top of each other. Smallest at the top, and they get a little bit bigger as you go down. And then at each of those, there's a joint with the one above it and the one below it. But there's not a single joint there. There's actually a big joint in the middle, and then 2 outrigger joints that are called the facet joints. And lots of times with trauma or overuse things, those facet joints will be kind of locked down and not moving well. And getting those to move well again oftentimes is what's needed. Or maybe it's the center joint that has the disc in between it. And the disc is fluid filled, and it can get herniated. People have heard of herniated discs. Lots of times if that comes out and pushes on one of the nerve roots, that will give them the pain, numbness, or tingling down an arm.
So all of that, that's a complex mechanical mess right there.
Hard to explain on the radio a little bit. But
yeah. So tell me about the connection to my shoulder blades and neck pain.
Sure. So there's a couple different points I would say. First off, posture has a lot to do with it. And so people that lean forward a lot, their shoulder blades are rounded forward. That's going to be putting yourself in an inefficient posture, and it's going to be increasing pain as you just live your average day. So lots of times these people will say, man, my upper back starts to hurt, by 2 or 3 in the afternoon as I've been sitting at my computer all day. Lots of times that can be a back issue, or it can be a neck issue. If you have a herniated disc, I mentioned how that can push on a nerve and send numbness, tingling down your arm. Another referral pattern would actually be to the upper back, to the shoulder blade area, and you may not even feel pain in the neck. Maybe you'll feel both, or maybe you'll just feel the pain in the upper back.
So if you're feeling any of that right now and you'd like to get some free advice from Nathan Miller from Steppin Up Physical Therapy, the number is 447-1190, or the toll-free is 800-333-1190. You can also use the text at 46862. Just start your message with Health Call, and it will come to us, and we'll put those questions in front of Nathan. So let's do a little posture check for the audience right now. What do you want people to be thinking about, and what should we be paying attention to?
Sure. Posture's kind of difficult in that you have to live your life. You can't think about posture all the time, but the more you think about it, the better you're going to be. So ideal posture is going to be sitting or standing upright. Your ear is directly over your shoulder, which is directly over your hips. And if you're too far forward, then that puts a lot of stress. If your head is too far forward, puts a lot of stress on the back of the neck. Those back of the neck muscles have to work extra hard just to hold up the weight of your head.
So the average human head is 8 to 12 pounds, I understand?
Correct.
Think about that. So your neck has to work all day long. I mean, when does it get a break? Only when you're laying down at night, right?
When you're laying down at night. If you have good posture when you're sleeping, sure. But the average weight of the head is 8 to 12 pounds. And your neck muscles are designed to do that. And they can hold it up pretty well. But that's when it's directly over your head with that ideal posture. That's what it weighs. If you think of maybe physics class from high school, there's a lever arm. And so the further something is away from you when you're holding it, it's heavier. So as your head goes forward, they actually say that 1 inch forward of the neck doubles the weight that your head feels like. And so your head now has to hold up, let's say 20 to 24 pounds. And if it's 2 inches forward, which a lot of people do have that kind of posture where their head is 2 inches forward, now they have to hold up 30 to 36 pounds.
So you're telling me that just simply sitting more erect and having good posture is going to make my neck pain that much better?
Yeah, because by the end of the day, your muscles just get worn out. And lots of times, the pain that people are feeling from neck pain is muscular fatigue.
And of course, all of us tend to do things that are out in front of us, right? I mean, especially with cell phones, for goodness sake.
Cell phones, computers, most jobs today, people are doing out in front of them.
Okay, so we have to fix posture issues, but then we also need to strengthen. I want to go back to those muscles around the shoulder blades again. You told me that we're all pretty much back sissies. In other words, our backs are not up to the job that we're asking them to do.
In a sense, yeah. So the muscles, especially the rhomboids, middle trap, those are the ones that connect your shoulder blade to your spine in the back. Those are the muscles that are basically the foundation of everything above it. And so if those are not strong, then even if your neck muscles are strong, they don't have anything to push against. It's trying to hold up something stable while you're on a trampoline. It's just going to be moving around all the time. And so if we can, if someone comes into me with neck pain, almost always we're going to be looking at those foundational muscles between the shoulder blade to the spine, getting those nice and strong, because the average person just doesn't have those strong. They tend to round their shoulders forward, and they're really strong and really tight through their chest, through their pectoral muscles, but the back muscles, not so much.
So what do I do? Give me some ideas of exercise or what I can do for that problem.
So certainly you can just work on sitting upright as much as you can, and then pinch the shoulder blades down and together. When I tell people to do that, almost always they will shrug their shoulders up. People have a tendency to shrug, and actually the muscles that pinch them down and together are typically inactive. So I would recommend standing in front of a mirror to looking directly at yourself and watching yourself as you do it. Do your shoulders raise? If that's the case, you may not be activating the correct muscles.
Okay.
You want them to almost go down and together, like you're putting your shoulder blades into your back pockets.
So that's a tough exercise for people to think about. You're right. I see where the mirror would come in handy there.
Yeah.
And how often? What's the formula for that?
Sure. If you're just getting started with it, I recommend do a set of 10. Hold it for 5 seconds. That's going to give you a little bit of both strength and correcting posture at the same time.
I know it's Heather and I here in the studio both doing the same thing while you're describing that, Nathan.
Most people do. And when you think about it, it's great, but it's just a matter of training the body so that it happens without you thinking about it. And so if you start incorporating this into your everyday activity, you do it 2 or 3 rounds, sets of 10 throughout the day, your body will start doing it more often without you having to think about it.
And so strengthening my back is the first step toward reducing neck pain. That's pretty interesting.
Oftentimes, yeah.
Yeah. So range of motion is the other thing. I've seen a lot of folks who just can't get all the way over one side to the other. What's going on there?
It's complex. It again depends on the person and what's going on. If they had a car accident, well, maybe there's some ligaments that are injured. Maybe there's some muscles that are injured. If they are, let's say, over 60 or 70 years old, maybe there's some arthritis in there. Everyone has arthritis. It's just a matter of to what extent and how that's going to limit you. So keeping your neck flexible when you're young, I think, is important, and making sure that you keep the range of motion that you have is important.
And is that just a matter of exercise again? Just make sure you're turning your head fully one direction or the other?
Yeah, I mean, some people, if you don't think about it, you don't really fully use that end range. And so getting back to using it is important. So just sitting upright, turning your head side to side, go all the way to the right, hold it for 5 to 10 seconds, and go all the way to the left, hold it for 5 to 10 seconds. If you're not able to do that because it increases your pain, potentially you may need to see a physical therapist, but you can also try laying flat on your back. Lay on your bed. If you can do it without a pillow, that's great. Some people's necks are so fixed forward that they can't lay without a pillow. So if you can lay flat on your back and turn your head all the way to the side, lots of times that will be less painful than if you're doing it sitting up, because you don't have the effects of gravity pushing down on your head.
Rebecca called and did not choose to be on the air, but she wanted me to ask you, Nathan, about glucosamine and chondroitin and other supplements. Are they effective in reducing joint discomfort and pain?
Glucosamine and chondroitin is definitely one of the best researched supplements out there, and it has been proven to be effective. I will tell you, as a physical therapist, medications, supplements is not my area of expertise, but I do know that glucosamine and chondroitin have been shown to be very effective, to as good of an extent as it can to people with arthritis.
And so what do your patients tell you about how they feel when they take those products?
Most people say that it's helpful. I know that it takes a little bit of time. You don't take it today and feel better tomorrow. It oftentimes takes a month to 2 months to feel the effects of it, but it is research backed to be beneficial.
So let's migrate a little bit into jaw pain, and that is fascinating to me that you can solve a neck pain problem in the jaw or vice versa, right?
Yeah, I was mentioning to you before, 80% of the time, people that have jaw pain do have associated neck pain. And so underlying issues can be, again, posture. A lot of it comes back to posture. And I was telling you that someone that leans forward gets jaw pain. If they can sit upright, they may even be able to open their mouth wider. They may have less pain immediately.
Now walk that through one more time. So if I have jaw pain, just changing my posture could solve that problem?
It could. Obviously, it's a complex issue like most things in the body, but I've seen it happen before, yes.
And you told me that you actually can do some manipulations?
Yes, so I, at times, this was not necessarily part of my regular physical therapy training. It was an extra course that I went to, but the jaw is similar to other joints in that it can respond well to joint mobilization. So I will put on gloves, I'll put my hand inside the mouth and can actually mobilize the joint to get it moving well if it's kind of stuck. You can also do soft tissue mobilization, help to relax jaw pain and or jaw muscles, temple muscles that are really tight. Those can be leading to the jaw pain too.
So what type of, is there an exercise for jaw pain that I need to be thinking about?
There's a whole lot of exercises for jaw pain. One of the first ones that I start people with, you got to make sure that you're not increasing the pain as you do these, but one of the first ones is you would put your tongue on the roof of your mouth. If you're having trouble finding that position, they say that you would say the word Norman, and then where your tongue finishes, that's the position. So your tongue is on the roof of your mouth, and then you open your mouth wide as you can, and then just hold that. You'll feel a stretch. Do that 5 times, hold for 10 seconds, and then open your mouth again. See, maybe did that have any effect on your jaw pain? Does it help your eating? Doing it one time may not be helpful, but you could start doing that every day as long as it doesn't increase your pain.
Norman,
and then stop.
Okay, good to know. Let's jump out to the phones, and Mike has a question for you. Nathan Miller of Steppin Up Physical Therapy. You've got his attention, Mike. Go for it.
Great. I have a question. Popping sound in my shoulder. It's not painful, but every now and then I do get a sharp pain. But you raise your arm, you get a pop. Sometimes when you lift something, you get a pop. Is that normal?
I wouldn't say necessarily that it's normal because you probably didn't used to have it, but it is very common.
I didn't, but every now and then you hear a knee pop, or it's just kind of that occasional popping noise that you get in your joints on occasion. But the shoulder seems to be doing it more often than.
So Mike, are you saying like when you crack your knuckles and that's the sound it's making?
Yeah. Mm-hmm. Yeah.
Okay. So what's happening there when you crack your knuckles, or in Mike's case, your shoulder?
I would say it's different. Let's talk about the shoulder. So it depends. As you're raising your shoulder, it's probably a tight muscle or a tight tendon flipping over the end of a bone, and that's giving you that popping. So doing it once or twice is no big deal, but if you continually do that, it's going to have an effect on that tendon. And so you don't want to keep doing that way. You probably have some sort of a strength imbalance, or where your muscles are tight, pulling you in a certain direction, causing that to happen. And so again, I would always look at posture because I'm a physical therapist, but what are you doing on an everyday basis that is maybe leading you to have this?
I lift. Not weights, but my job requires lifting.
Okay, so how much weight are you lifting, and how are you lifting it?
Anywhere from 15 to maybe 100 pounds. I try to lift my knees, but there are times when your this sound comes anytime you just stretch your arm out. So
sure.
Sometimes, and it doesn't always have to do with lifting.
So how would you diagnose that and find out what muscles are weak here?
Yeah, it's hard to do without actually seeing him. It would start with observation. I would watch how he would move. I would watch how he would reach overhead, feel when the popping's happening, and then do some special testing to see, is there any kind of an actual injury in there where the rotator cuff maybe has an issue, or where the labrum has an issue. Is there a muscular issue? To me, at this point, it sounds like it's muscular, and it seems like the kind of thing that you could help it by stretching. Most of the time, people in your situation that are doing lifting, it sounds like at work or around the house, most of the time you're going to be tight through your chest. And so you can stretch that by standing in a doorway. You put one arm up on the doorway and lean forward to feel the stretch in the front of the shoulder and in your chest. I would do that for a longer hold, 30 to 45 seconds. Again, as long as it doesn't increase your pain.
Mike, go ahead. Did you have a question there?
No. I was just taking mental notes. So it definitely sounds like something I'll try. And if that doesn't work, you do physical therapy could be an option as well.
Yeah, I think so. I would definitely start with those exercises, and then don't let it get worse. Make sure you're staying on top of it, so that physical therapy is the option, and you don't let it go so long that then you get into a bigger situation.
And Mike, before we brought you onto the program, Nathan and I were just talking here in the studio about what direction your thumb is pointing as you lift. When you are on the job, what orientation is your hands and your thumbs?
I really never thought of that, but just normally either under or over. In most cases, it would be over if I'm using my right hand. I tried not to, now with popping noise, I try not to use the right hand to handle most of the weight, so it's over. But generally, I guess when I'm doing most of the weight, it's under.
So your thumb is pointing down?
No, thumb would be pointing up.
Thumb is pointing up, okay.
Thumb is pointing up is definitely a better situation. It allows the humerus, the arm bone, to externally rotate, and it makes impingement a lot less likely just based on the anatomy of the shoulder. So that's definitely good, but you also want to make sure that you're pinching the shoulder blades back whenever possible.
Yes, I heard that exercise. I'm going to start doing that as well, just for the sake of trying to stay on top of things. But I do appreciate your information. It's a good program, and I will, like I said, if it doesn't improve anytime soon, I think I may look into the physical therapy. You guys just opened, I think, a new one up out by where I live at. So
awesome.
Off of North Clinton. So I may have to stop in after.
Great, thanks, Mike.
Thank you.
Glad you're listening. Thanks for the call. Hey, we've got about a minute or so left, Nathan. What is the point that you think is important for people to hear right now?
Yeah, I think that most important, I would say, is be proactive about this. If you are having some neck pain, deal with it now. That doesn't mean that you need to go see a professional, but educate yourself on what things you can do. Start with some basic exercises, maybe some of these that we've had, that we've talked about, maybe some that you can find online. Mm-hmm. Don't put yourself into pain while you're doing them, but start doing them. Get your neck more loose and stronger, and that's going to help you in the long run. People come in sometimes. For example, I'm thinking of a man, he was 72 years old, I think, had very poor posture, leaning forward. Standing upright was just not possible for him because he waited a little too long. So go ahead and start now trying to get your neck right.
Excellent point. That is Nathan Miller, a physical therapist with Steppin Up Physical Therapy. You will find them at steppinupt.com. And you know what? People have asked me about this. There's no G. It's step in, not stepping. Steppinupt.pt.com, and that's where you will find them online.